My name is Cozy Joseph. I am a co-founder and the chairperson of the Gascov Clerget Foundation. Gascov Clerget Foundation is a nonprofit philanthropic organization. We founded the organization in memory of my late brother, Gascov Clerget, back in March 1999, March 7th to be very specific. My brother passed away. You have to realize that he was at a party on Friday, was taken to the hospital on Saturday, and by Sunday afternoon, he was gone. So we were really devastated by the sudden death. And we later found out that he actually had cancer and didn't know he did. So in his memory, his friends and his family came together, and we decided that we were going to start the Gascov Clerget Foundation, not only in memory of his legacy, but also to give back in his memory. And we started with a small medical mission. That's when we realized that there was a huge need for this, and that the population, that the people in our community, in my hometown, actually really needed this. And that's really the motivation that kind of got us going.
I've been a board member for probably over 10 years. And I was brought to GCF by a great friend of mine. And he said that you gotta come with us this year to that mission trip. So my first experience with GCF was going to the mission trip. I have never seen such cases that I encounter in this part of the country, in Lekai, in that hospital. And what they have in this hospital to work with, it's like working just with their hands. So, and this experience humbled me. And to a point that when I came back to the state and I called Cozy, that's the chairperson of the foundation, and say, I would like to be part of it. I would like to help you raise money for this foundation.
Currently, we have a medical center. It's called Clinique for Fred. We offer pediatric services. We offer internal medicine. We have a dental clinic. We have a lab. We do x-rays, and I believe we also do sonogram. So the clinic is in a rural community near a town in Haiti called Lekai. I believe Lekai is the third largest city in Haiti. Where we're about 15 to 20 minutes away from Lekai, but because of the road conditions, it's not really that easy to get there. So the key to the story, though, is that it's not just the people from that community who come. I mean, we have people who literally walk hours to come see a doctor at Clinique for Fred. And one of the biggest things that I'll highlight is that whether the country is in shambles or not, because our staff is local, okay, we're able to keep the clinic up and running. You know what I mean? It's not us, a bunch of folks who are coming from a foreign country who can decide not to go at any minute. We've had to cancel missions. It's just that these people, this is their community, they're local, and they are very dedicated to serving their community.
I normally go to medical mission trips in Haiti once a year. And when I go, we go 4 days mission trip where we give the care and we leave these patients. We do medication teaching with them and we leave them with medication. And coming back home, it always bothers me in a sense as a nurse, because what we do in the settings here in the US, we give medication, we give teaching, but we also do follow-up with these patients to see how effective these medications and treatment that we're giving them is taking effect. And when I heard about GCF having a clinic that's set up in Haiti, to me that was like, wow, this is what we need.
When you find an organization who's really focused on helping those who need health care, as we know, this is a problem in Haiti, that people don't have good access to health care. You know, it's very important for me to do my parts, even if I cannot go and do it myself. But helping the organization, raising funds, and putting the words out there to inspire other people to also help is very important to me.
Over the years, I really believe that we must have impacted, I'm going to say close to 60 to 80,000 lives. At the end of the day, it's more out of duty that I feel like I'm doing this. I feel like I have a duty to serve my community, whether I serve here in Palm Beach and in Haiti. I feel like it's my duty to serve. And the fact that the people in Haiti are actually dependent on the activities that I do so that we can serve them through the clinic makes it that much more special to me.